Hey guys, this is Omar Davies, a student at UCF. I'm from Daytona Beach, Florida. I'm currently here in Cape Town, South Africa, doing an internship for Health Systems Trust. It's a medical research organization, and I'm here for a 2-month stay, and I'm helping them out with their research, so come right in. This is actually my workstation over around this corner. I'm working on a literature review right now for, they're kind of copying a Brazilian model here in South Africa that deals with community health workers. What that is, it's these people in primary healthcare that pretty much go to communities and go door to door and help with healthcare interventions, HIV screenings. They tell their people their results after the screenings, and they found that it's extremely successful in lessening the disease rates. I came to Cape Town pretty much to diversify myself from the rest of the student body. I think a lot of people do internships and they do volunteer work locally, but not internationally. The limited resources and the high prevalence of different diseases here has kind of opened my eyes to a totally different side of healthcare. I think this is something that I can take back to the University of Central Florida, not only to grow as a person and a student, but to help others in my field as well. While in Cape Town during my internship, I got an amazing opportunity to travel to Mpumalanga, which is a northeastern province, a little bit closer to Mozambique. Over there's a very high prevalence of HIV, tuberculosis, mothers transferring HIV to the babies, a high rate of stillborn children. One of the things in Mpumalanga that really stood out to me was playing with these kids at a preschool. We were on our way to a clinic, and on the way to the left, I saw a preschool with maybe about 50 to 70 kids, and they were all just in the field playing, and I asked the senior researcher actually if me and Matt could stop over there, and it was crazy because as we went over there to give them food through the gate, the teacher actually let us in, and one of the coolest things was I was teaching them English words, and they had no idea what it meant obviously, but they would repeat it as a group, and it was just a bunch of synchronized voices, and they all spoke Zulu. But for that 30 minutes, they were speaking the words that I was teaching them. So I think that was great, and I think that really, that interaction will probably last a lifetime. That's something that I'll always remember. I'm extremely appreciative of the opportunity that UCF has given me. I think this is a huge stepping stone to becoming a better clinician in the States. The environment, the different cultural interaction, and the clinical experience has been great for me in South Africa. I think this is one way to diversify yourself, and not only that, the clinical interaction and the research I think will prove very effective in not only getting into graduate school, but becoming a very successful clinician in the future.